Good morning, student. In the last lecture, you learned about the femoral triangle, and one of the important contents of the femoral triangle are femoral artery, femoral vein, and the femoral nerve. So today we are dealing with the femoral artery and the femoral nerve. Objectives of the today's lecture are the origin, course, relations, branches of femoral vessels, and the femoral nerve. Femoral artery, it is the main artery of the lower leg, and it is the one of the most important content of the femoral triangle. Femoral artery is the continuation of the external iliac artery. Here is the abdominal aorta, which divides into right and the left common iliac arteries, and then the common iliac artery divides into internal iliac artery and the external iliac artery in the pelvis, and after that the external iliac artery will continue as a femoral artery just below the inguinal ligament. So here is the femoral artery. Okay. Femoral artery begins behind the inguinal ligament at the mid-inguinal point. Extent of the femoral artery, it runs from the mid-inguinal point to the opening of the adductor magnus. So in this diagram, here is the anterior superior iliac spine, and here is the pubic tubercle, and here is the pubic symphysis. I think you have studied the hip bone and you know that where is the pubic tubercle and the anterior superior iliac spine. So between the anterior superior iliac spine and the pubic tubercle, there is a inguinal ligament. So inguinal ligament is attached medially to the pubic tubercle and laterally to the anterior superior iliac spine. So the femoral artery runs from the mid-inguinal point, that is the midpoint of the line between the anterior superior iliac spine and the pubic tubercle up to the adductor opening in the adductor magnus. So here is the tendinous opening in the adductor magnus muscle. It is directed downward and medially. Okay. It enters the femoral triangle behind the inguinal ligament, that is at the mid-inguinal point. Then the artery passes downwards medially and leaves the femoral triangle through its apex below the sartorius, and you know that the apex of the femoral triangle continue with the adductor canal. Okay, it traverses the adductor canal and appears in the popliteal fossa. So in the diagram, you can nicely appreciate the femoral triangle and its content along with the femoral nerve, femoral artery, femoral vessels. Okay, here are the contents of the femoral triangle, and here is the apex which will continue with the adductor canal. Okay. Then it will continue as a popliteal artery after passing through the fifth osteoaponeurotic opening of the adductor magnus muscle. Proximal 3 to 4 centimeter part of the femoral artery along with the vein is enclosed in the femoral sheath. So here you can see the femoral sheath. So the proximal 3 to 4 centimeter part of the femoral artery along with the vein is enclosed in the femoral sheath like the axillary artery. Okay. Now coming to the relations of the femoral artery with the femur. The artery lies over the head of the femur next on the medial aspect of the shaft of the femur and subsequently behind the shaft of the femur. So here is the relation that it lies along with the head of the femur. Then it lies along the medial aspect of the shaft of the femur and subsequently it passes behind the shaft of the femur. The artery can be compressed over the head of the femur effectively to prevent the bleeding in case of injury to the artery. So here the artery can be pressed to prevent the bleeding. Okay. Relations of the femoral artery. The relations of the femoral artery are divided into two parts. relations of the femoral artery in the femoral triangle and the relations of the femoral artery in the adductor canal. We know that it is present in the femoral triangle as well as also in the adductor canal. So we are dividing the relations of the femoral artery into two parts, relations of the femoral artery in the femoral triangle and in the adductor canal. First, we will consider the relations of the femoral artery in the femoral triangle. Okay. The anterior relations are skin, superficial fascia, superficial inguinal lymph node, superficial circumflex iliac vein, and the fascia lata, and along with the anterior wall of the femoral sheath and the femoral branch of the genitofemoral nerve. So, skin, superficial fascia. In the superficial fascia, there are superficial inguinal group of lymph nodes, then superficial circumflex iliac vein, fascia lata, nothing but the deep fascia, anterior wall of the femoral sheath, femoral branch of the genitofemoral nerve, saphenous nerve, nerve to the vastus medialis, and medial cutaneous nerve of the thigh. These are the anterior relations of the femoral artery in the femoral triangle. Posterior relations from above downward, it lies on the psoas tendon, then pectineus and the adductor longus, that is the floor of the femoral triangle. Okay. Lateral relations. In the upper part, trunk of the femoral nerve. Laterally, there is a femoral nerve in the upper part and the lateral cutaneous nerve of the thigh here. Okay. Here is the femoral artery. Lateral to that, in the upper part, there is a trunk of the femoral nerve and the lateral cutaneous nerve of the thigh. In the lower part, there is medial femoral cutaneous nerve of the thigh, saphenous nerve, and the femoral and branches of the femoral artery. Medially, there is femoral vein. So, by the diagram, you can nicely appreciate all these relations and you can remember. Relations of the femoral artery in the adductor canal. Anteriorly, covered with the fibrous roof, subsartorial plexus of the nerves and the sartorius muscle. So, anterior relations, here are the anterior relations. Anterolaterally, there is vastus medialis and nerve to it. Medially, there is saphenous nerve and laterally, there is a femoral vein. So, these are the relations in the adductor canal. In the diagram, you can nicely appreciate, you have to appreciate anterior part, anterolateral part and medial part. Okay. Coming to the branches of the femoral artery, they are divided into two groups, superficial branches and the deep branches. So there are three superficial branches: superficial circumflex iliac artery, superficial epigastric artery, superficial external pudendal artery. So here are the three superficial arteries. Okay. Superficial external pudendal artery, superficial epigastric artery, and superficial circumflex iliac artery, which runs towards the anterior superior iliac spine. Deep branches are deep external pudendal branch. Here is the deep external pudendal artery. Okay. Then profunda femoris artery. Here is the profunda femoris artery. Then there are many muscular branches and the descending genicular artery, which is given in the adductor canal. Okay. So the seventh branch of the femoral artery, that is the descending genicular artery, which is given in the adductor canal. Superficial epigastric artery, it pierces the cribriform fascia and the femoral sheath. It runs upwards across the inguinal ligament to the umbilicus. It lies between the two layers of the superficial fascia of the abdomen. Okay, so here is the superficial epigastric artery. Superficial circumflex iliac artery pierces the fascia, then sheath and the fascia lata. It passes laterally below the inguinal ligament to the anterior superior iliac spine. So here is the superficial circumflex iliac artery, which runs laterally towards the anterior superior iliac spine. Superficial external pudendal artery pierces the cribriform fascia and the femoral sheath. It passes medially in front of the spermatic cord or the round ligament of the uterus. Deep external pudendal artery. It pierces the fascia lata and passes behind the spermatic cord to supply the scrotum and the labium majus. Descending genicular artery arises from the lower part of the femoral artery in the adductor canal. It gives off saphenous branch and anastomosis with the superficial medial genicular artery of the popliteal artery. So, descending genicular branch is the last branch given in the given by the lower part of the femoral artery, and it is given in the adductor canal. Okay, and this descending genicular artery gives off saphenous branch and it anastomosis with the superior medial genicular artery of the popliteal artery. So in the genicular anastomosis, it takes parts in the formation of the genicular anastomosis. Coming to the profunda femoris artery. It is the largest branch of the femoral artery. It is given in the femoral triangle. It provides the main supply to the extensors, adductors, and the flexor muscles of the thigh. It takes origin from the lateral aspect of the femoral artery, about 3.5 to 4 centimeter below the inguinal ligament. So the profunda femoris artery arises from the lateral aspect of the femoral artery, 3 to 4 centimeter below the inguinal ligament. It terminates in the form of fourth perforating branch of the profunda femoris, which takes parts in the anastomosis around the knee joint, that is the genicular anastomosis. Course of the profunda femoris artery. It arises from the lateral aspect of the femoral artery in the femoral triangle, 3.5 to 4 centimeter below the inguinal ligament. Here is the profunda femoris artery. Okay. Gradually, it turns behind the artery with a medial inclination. So, this artery will pass behind the femoral artery and medial. It leaves the triangle by passing through the gap between the adductor longus and the adductor brevis muscle. In its further course, it passes in front of the adductor magnus muscle. As finally, it pierces the adductor magnus as a fourth perforating artery and anastomosis with the superficial muscular branch of the popliteal artery. So here is the femoral artery, and it will continue as a popliteal artery, and here is the profunda femoris artery. Relations. Anteriorly, it is related to the femoral artery, femoral vein, profunda vein, and the adductor longus muscle. Posteriorly, it lies on the pectineus muscle and the adductor brevis magnus, and from above downward. Laterally, it is related with the vastus medialis muscle. Branches are of the profunda femoris divided into two groups: branches in the femoral triangle and branches during the rest of the course. Branches given in the femoral triangle by the profunda femoris are medial circumflex femoral artery and the lateral circumflex femoral artery. So here is the medial femoral circumflex artery and here is lateral circumflex femoral artery. During the rest of its course, it provides muscular branches and the perforating branches. Okay. So the branches of the profunda femoris are medial circumflex femoral artery, lateral circumflex femoral artery, muscular branches, and the perforating branches. Lateral circumflex femoral artery takes origin from the profunda femoris, leaves the triangle by passing under the sartorius muscle. It passes under the cover of rectus femoris and divides into ascending, transverse, and the descending branches. So here is the profunda femoris and here is the lateral circumflex femoral artery, which passes behind the sartorius muscle and then divides into three branches: ascending branch, transverse branch, and the descending branch. Okay. Medial circumflex femoral artery. The origin of this vessel is variable. It may arise from the femoral artery or the profunda femoris artery. Okay, it passes between the psoas major and the pectineus muscle. It passes between the psoas major and the pectineus muscle. So here is the pectineus and here is the psoas major. So here is the medial circumflex femoral artery. Then it passes between the adductor brevis and the obturator externus muscle. Okay. Further, it appears between the quadratus femoris and the upper border of the adductor magnus. Here is the quadratus femoris. Here is the adductor magnus. Okay. Here it divides into ascending and the transverse branches. So here is the ascending branch and here is the transverse branch. Okay. Then acetabular branches and the small branches to the head of the femur. So it will give mainly medial circumflex femoral artery supplies the head of the femur. So that is the more clinically very important. Perforating branches, they are 4 in number, pierces the adductor magnus and the lateral intermuscular septum to supply the adductors and the hamstring muscles. Here you can see first, second, third and the fourth perforating artery. Here is the adductor brevis, adductor magnus. They end in the vastus lateralis muscles where they are connected to one another by a series of anastomosis. They will form the series of anastomosis in the vastus lateralis muscle. First perforating artery lies above the adductor brevis. Okay. Second arises in front of the adductor brevis and pierces the adductor brevis and the magnus muscle. It gives nutrient artery to the femur. So the second perforating artery will give the nutrient artery to the femur. Okay. Then third perforating artery arises at the lower border of the adductor brevis muscle. Fourth one is the continuation of the profunda femoris. At the back of the thigh, each perforating artery divides into ascending and the descending branches close to the insertion of the adductor magnus muscle. They anastomosis with one another. The highest one anastomosis cruciate one and the lower one with the popliteal artery. Thus, the arterial chain is established at the back of the thigh, which is more potential than the actual. These branches are closely related to the linea aspera. I think while studying the femur, you have seen the linea aspera, which is present on the posterior surface of the femur. Coming to the applied anatomy, if the femoral artery is ligated proximal to the origin of the profunda femoris, then the collateral circulation is established through the anastomosis between the branches of the profunda femoris, internal and the external iliac arteries. That is the clinical application. Now coming to the clinical anatomy of the femoral artery. Femoral pulse. Clinician feels the femoral artery pulsation in the femoral triangle just below the mid-inguinal point by palpating against the head of the femur. So in this way, the femoral pulse is palpated. Importance. Bilateral weak pulse compared to the radial pulse is indication of the coarctation of the arch of aorta. Femoral pulse may be reduced or obliterated by atherosclerosis, blockage of the common iliac artery, external iliac artery, or the arteries by the embolus. Femoral artery is relatively superficial in position in the thigh. Therefore, it is easy to approach the artery for various procedures. So it lies very superficial in the femoral triangle. So it is easily accessible for various procedures, such as to inject the radiopaque dye in arteries of abdomen, that is aortic, celiac, superficial, and the inferior mesenteric arteries angiography. So for the various angiography of the arteries of the abdomen, the choice of artery is the femoral artery. It is a favored vessel for angiography and the angioplasty, in which catheter, after entering the femoral artery, passes to the external iliac, then the common iliac artery, then abdominal aorta, descending thoracic aorta, arch of aorta, ascending aorta to reach the coronary artery. So from the femoral artery, we can reach up to the coronary arteries. Femoral angiography is done to visualize the artery and its branches. Sudden occlusion. Occlusion blocked in the block in the femoral artery usually occurs due to the emboli from the heart. This may occur due to the myocardial infarction or the thrombi in the left atrium in the mitral stenosis, traumatic injury to the artery in the fracture of femur, or in the diabetes. It presents as a 5-piece: pain, pallor, paresthesia, paralysis, and pulselessness. So these are the 5-P's: pain, pallor, paresthesia, paralysis, and the pulselessness. Serious complication of acute occlusion is gangrene of the lower limb. Gradually narrowing of the femoral artery due to the atherosclerosis may occur. Femoral artery aneurysm is the condition that is demonstrated by the localized blood-filled balloon-like bulging and the weakening of the walls of the blood vessels. Femoral artery pain. This may occur because of the blockage of the artery. The pain is experienced in the leg or the feet as the blood is unable to flow downwards due to the blockage. Coming to the femoral vein, begins as a continuation of the popliteal vein at the opening of the adductor magnus muscle. From the adductor canal, vein enters the femoral triangle through the apex. Here it lies behind the artery. As the vein ascends, it shifts to its medial side. It continues as a external iliac vein behind the inguinal ligament. It is placed in a special compartment of the femoral sheath lateral to the canal, which allows the dilatation of the femoral vein during the increased venous return. Relations. Anteriorly, it is related to the skin, superficial fascia, deep fascia, saphenous opening, cribriform fascia, anterior wall of the femoral sheath, small part of the femoral artery at the apex, saphenous nerve, medial cutaneous nerve of the thigh, and the long saphenous vein with the superficial group of lymph nodes. Posteriorly, there is adductor magnus, longus, and the pectineus muscle. Medially, there is femoral canal and the saphenous nerve in adductor canal. Laterally, there is femoral vein artery, femoral branch of the genitofemoral nerve. Two walls are present. One is at the upper part of the vein near the base of the femoral triangle, and one is below the opening of the profunda femoris vein. Clinical anatomy of the femoral vein. It is used for taking the blood samples, infusion, and transfusion in the children. Cardiac catheter can be passed to reach the pulmonary trunk by obtaining the blood sample from the pulmonary veins. For the pressure recording to approach the pulmonary arteries. So these are the clinical importance of the femoral vein. Tributaries of the femoral vein are profunda femoris vein, long saphenous vein, muscular tributaries, medial circumflex vein, and the lateral circumflex vein. Coming to the femoral nerve, it is the largest branch of the lumbar plexus. It is the nerve of the extensor compartment of the thigh. It is formed by the dorsal divisions of the anterior primary rami of the spinal nerve, second, third, and the fourth lumbar nerve. So here is the formation of the femoral nerve. So here is the femoral nerve. Here also you can appreciate the femoral nerve. Course, it comes out of the psoas major muscle at its lateral border. So here is the psoas major muscle. Initially it lies in the substance of the psoas major muscle, and it comes out from the lateral margin of the psoas muscle. Thereafter, it lies between the psoas major and the iliacus muscle. So here is the psoas major muscle and here is the iliacus muscle. After the formation, the initial part of the nerve lies in the psoas muscle. Then It will come out from the lateral margin of the psoas major muscle, and then it lies between the iliacus and the psoas major muscle. Okay. Then here it is under the cover of the fascia iliacus. It occupies the interval between the psoas major medially and the iliacus laterally. It enters the femoral triangle by passing under the inguinal ligament lateral to the femoral artery and outside the femoral sheath. Here is the inguinal ligament, so it will come out. It passes behind the inguinal ligament and it will enter into the femoral triangle. Here it lies lateral to the femoral artery. It divides below the inguinal ligament into anterior and the posterior division. Immediately, it divides in the femoral triangle into anterior and the posterior divisions. Okay. Branches of the femoral artery. From the trunk, it provides 3 branches to the iliacus, pectineus, and the few vascular branches. So, it will supply the iliacus muscle, pectineus muscle, and the vascular branches. In the thigh, that is in the femoral triangle, it divides into anterior and the posterior divisions. Anterior division gives 1 muscular branch to the sartorius muscle and the 2 cutaneous branches, medial and the intermediate cutaneous nerve of the thigh. Posterior division gives muscular branches to the quadriceps femoris, that is the rectus femoris, and the 3 vasti muscles. Nerve to rectus femoris, through it supplies the hip and the knee joint. Nerve to vastus lateralis supplies the knee joint. Nerve to vastus medialis also supplies the knee joint. Nerve to vastus intermediate it supplies the knee joint and the articularis geni. 1 cutaneous branch is given, that is the saphenous nerve. Here is the 1 cutaneous branch given by the posterior division of the femoral nerve is the saphenous nerve. This saphenous nerve is the longest cutaneous nerve of the body. It extends downward along the lateral side of the femoral artery in the femoral triangle and upper part of the adductor canal. It crosses the femoral artery from lateral to medial side in the middle of the adductor canal. Here you can nicely appreciate that saphenous nerve is crossing the femoral artery from lateral to medial side. And then it comes to lie on the medial side of the femoral artery in the adductor canal. Okay, so here is the saphenous nerve. It is the longest cutaneous nerve of the body. It gives off infrapatellar branch after coming out of the canal. It becomes superficial as it comes out of the medial aspect of the knee between the sartorius and the gracchalis tendon. It runs with the greater saphenous vein up to the medial malleolus. It supplies the skin of the medial side of the knee, leg, and the foot, except the medial side of the great toe, which is supplied by the superficial peroneal nerve. Coming to the clinical anatomy, the femoral nerve and obturator nerve supply the hip joint and the knee joint. Therefore, diseases of the hip produces referred pain to the knee. Injury to the femoral nerve by wound in the groin causes the paralysis of the quadriceps femoris. Femoral nerve block. The anterior approach to block the femoral nerve at the groin, that is the inguinal region, is the most commonly preferred for the knee surgery. Thank you. This is all about the femoral artery and the femoral nerve. You may get full question and on the femoral artery or short notes like enumerate the branches of the femoral artery, short note on the profunda femoris artery, short note on the femoral nerve. So in this way, you have to prepare the questions. Okay. Thank you.